Now, if I'm in my 60s, my PSA is 2.6, my relative chances or relative risk of getting prostate cancer has gone down even further by 8 times. So it's a little bit complex to understand, but basically it's telling you that PSA isn't a very good test, is it? We all know it's not specific, but it's far more valuable when you're young. It's far more indicative of whether you're going to get prostate cancer when you're young. And that's why we're recommending that men get tested when they're 40 or in their 40s, because we have a marker to say, oh, your PSA is high. Your PSA is 2.6. You've got 100 times the normal rate of getting prostate cancer. We're going to watch you very carefully. Okay? So PSA is a better test the younger you are. And the main reason for that is because when you get older, you get more of this, benign disease, and that makes PSA. So it clouds the picture. We're measuring something that's produced by two things. Doesn't it make more sense to test it when the other thing doesn't get in the way? Doesn't it make more sense to test it when you've got less benign disease? And that's when you're young. When you get older, we all get this, and that just clouds the picture. So that's why checking men when they're early gives us a very good marker for the future, their future risk. So what to do? I would recommend that men get checked in their 40s, and depending on what the results are, they get checked every year or two for a few years. Now, if you are a man at high risk, you should get checked in your 30s. Now, what's high risk? Essentially, those with a family history. So those of you out there who say, yep, Dad had prostate cancer, my brother's got prostate cancer, or my brothers have got prostate cancer, you're at increased risk. You need to be checked earlier. Now, the part you've all been waiting for, and this is the real reason, ladies, that men don't want to go to their urologist to get their prostate checked. They won't tell you that they're scared, but they're scared. And they feel it is like preparing for battle, but it's not. It really isn't. It's pretty simple. My fingers are pretty small. It takes about 10 seconds. And, you know, just relax. Think of England or wherever. And it really isn't too bad. It really isn't too bad. And yeah, this isn't the typical face. This isn't the typical face, but this is what most guys think. And we do have to be lucky that we invented that test, because I really do worry. The mammogram. I quite like that. All right, now, the other thing, what do all these women have in common? They're smiling? Yep. Anyone know why they're smiling? They're not married? It could be. No, their husbands are getting rectal examinations. And it's true, it's an interesting phenomenon that I discovered, is that, you know, the husband, and I encourage you to come with your husband, it's great, because then you save him saying, what did the doctor say? Oh, nothing, everything's all right. And then I get in trouble for, you know, not being communicative. So it's an interesting phenomenon that you get up from the table, the man gets up like a schoolboy on his first day of school, heads towards the bench. The women can't help but smile. It's true. They get a very satisfied smile, smug smile on their face. And I think it's all those years of pap smears and childbirth. So. Yeah, but it's important. People say, well, I've done the blood test. Why do I need to have the finger test? Some prostate cancers are very irritating in that they don't produce PSA. So occasionally, and sometimes those prostate cancers are actually really aggressive prostate cancers. They don't make PSA. So if you've got a lump in your prostate, again, it doesn't mean you've got prostate cancer, but it's a reason to get checked out. So unfortunately, the rectal examination is important. Okay? The only thing I'd advise you to do is don't choose this guy to do your rectal examination. Always go for this guy. Okay? So Tim Matheson was right. You know, go for the small Asian hands. I think is a very wise thing. I don't know why I got so much grief for it. Otherwise, because if you don't, this is what we end up with. So, in conclusion, urinary symptoms are common as we get older. It's normal. And it's important to remember that early prostate cancer really can have no symptoms, okay? PSA and rectal exam can save lives, And I think it's important that men get checked when they're younger, before they have any symptoms at all, when the PSA is more valuable, when you don't have the benign disease clouding that picture. It's really important. And then we can identify those men at risk and follow them more closely. And we can do what our critics want us to do and get smarter at treating those patients who are more likely to die of the disease than those who aren't. So thank you very much.